Hey everyone, I'm Dr. Ellie and I'm here with my podcast, I Heal Kids. And I'm just very excited for this episode today because I've been getting a lot of questions about this. And the question is, why are you different? So lots of meet and greets, lots of questions about what makes me and my practice different than an insurance-based model and why is it better? So I want to welcome you to I Heal Kids. If you don't know me, I'm a holistic pediatrician here in Asheville, North Carolina. I help kids and their families thrive using a blend of integrative, functional, and conventional medicine. And for those of you who don't know this already, if you're a burned out parent, I will see you too and help you with your functional medicine. Okay. So be sure to listen in. But I really want to talk to you guys about something that's been kind of close to my heart for a while, and also why I started the practice, which is really just like, how can pediatric care or just care in general be and should be different? Okay. So if you've ever walked out of an appointment and you're just like, I'm so done with this appointment. I just felt like I was rushed. I was dismissed. Like nobody listened to me. They just acted like my problems were just like really dumb and like wasn't taken seriously. I will tell you, you are definitely not alone. I myself have been there. Sadly, you would think that as another doctor, you wouldn't experience that kind of treatment, but sadly, it even happens to other healthcare providers. So I want to talk to you about why I created a wellness-centered root cause approach to health, in particular, kids' health and parents' health. And also why I think why I think it can change the world. Let's be honest from a health perspective. Like I said, the question that I get often is like, why are you different than like some insurance-based practice where I just go in, like I see someone for 5 minutes and they give me a medicine and I walk out and I leave and that's that. Well, that's because in most pediatric settings today, or really healthcare settings in general, we're very focused on, or at least the healthcare community is very focused on treating disease and illness very reactively. Okay, so your kid gets sick and you get what? Like an antibiotic usually, and then you go home. That's the end of that until they start having gut problems and all the rest. And then you come see me. We'll talk about that in a different episode. In fact, I think I have a few on that, so we'll link those. And there is a place for that, of course, when kids are really direly ill, we don't want to not treat them. And sometimes there are cases where pharmaceutical medication is needed when things are very, very severe, or God forbid, you're in like a motor vehicle accident and you need blood or a cast or, something's happening, there's a place for Western medicine. But what if instead of just kind of like managing these symptoms, what if we just kind of ask why is this symptom showing up? So I just kind of believe that we're missing something bigger with this kind of sickness model, right? So it's like you go in, you're given a diagnosis, like a title, like, okay, well, you have this cluster of symptoms. That means you have X, Y, and Z. Like, let me give an example. You have a fever and a cough and your breathing is fast. You have tachypnea. So I think you have pneumonia and here's some antibiotics. But what if we said, why do you have pneumonia? What is going on? And you told me, well, you know what? I've been run down. I've been working at my job like crazy. I'm working 80 hours a week. I haven't had a vacation in 2 years. I have 3 kids under the age of 3. And I'm going to say, well, your immune system is shot. So we need to work on what? Probably your adrenals, because you might have adrenal fatigue, which impacts the immune system, which does what? Lowers your ability to fight infection, and then you end up with infections. So we need to ask these kind of bigger questions rather than just managing symptoms. Now, it's not that we don't want to ever manage a symptom while we're also treating root causes. Of course not. We're going to do both, right? But I want to make sure that we are asking why is the symptom showing up? And what is the child's body or behavior trying to tell us? And these are kind of the deeper questions that let us know, how can we support their system so these issues, don't keep coming back? Because that's what happens, right? In a lot of, not all cases, but in some case, I will say most cases that come and see me, this is what happens is you go to your pediatrician, let's say they have constipation one time, they get Miralax and they get better for a minute and then they can't poop without the Miralax. So what do we do then, right? So it's all about, changing that up and having you In that example, let's say you come in and I'm like, oh, you know what? Actually, upon chatting with you, looks like it could be a dairy sensitivity. Not only that, there's some behavioral stuff we need to work on with a therapist, not like necessarily a talk therapist, but like an occupational therapist, or maybe there's sensory issues. Also, maybe they have a vitamin C deficiency and that's why they're not pooping, or magnesium, whatever it may be, depending on the situation and the testing. And it's all about figuring out like, well, why were they even constipated in the first place? Were they scared to poop at school or embarrassed? And that's why, so we have to kind of stop putting band-aids on everything and waiting until kids are really, really struggling to kind of get help. So we need to optimize their genetic potential rather than just react to problems when they come up, in my opinion. All right. Another reason that I think I'm different, well, I kind of know I am, is that my approach, I describe it as like slow cooker medicine. It is not about a quick fix, you guys. It is really about deep, nourishing care, deep work, and it really takes time, especially when we do functional medicine. Now, if you're coming to me for general like wellness care, let's say you've had a new baby and we just want to optimize their health, that takes the kind of time that, is care from 0 to 21, right? So we're talking about like long-term care because that's what pediatric care is. But we're not necessarily in that case trying to solve like a problem. That said, if you're telling me, well, my child has had tummy pain for 10 years, that is going to take deep work. So the most likely there'll be changes in what diet, in our stress reduction techniques, in supplements that the body may need for a while, in how we're approaching our environment, all of the toxins. Do we have mold? Do we have cryptopyrals? Like, are our genetics a problem? Do we have an MTHFR? Do we have a COMT that's not working well? So all of these things, we have to address, and that really takes time. So it's not about, well, here's a pharmaceutical that is going to, put a Band-Aid on it and that's the end of the story. It's more about how can we correct the deep physiology of what's going on in the cells, in the body, and the interrelation of all of the systems. So how do the adrenals relate to the immune? How does the immune relate to the gut? How does the gut relate to the liver? And back and forth, right? Because everything's connected to everything else. As we know, our bodies are not separate. It would make it so much easier if we had a reductionistic viewpoint of our bodies. And it was like, I'm trying to think if there's anything that even a splinter. Yes, you can take the splinter out, but we still need to like make sure you don't get an infection from the splinters. Like everything's related, you guys. So my point with all of this, with saying this is deep, nourishing care and that it takes time, is just to let you guys know that honestly, that is what most kids and families and really people in general need. Is the body is supposed to heal. Like it wants to heal. It wants to get better, but it can't do it overnight. All right. So I'll just give you like a few examples to kind of illustrate this so you guys know what I'm talking about. So I had a kiddo that was having trouble focusing at school, which is not uncommon. His parents were like, what can we do other than just like jump to medication? Which sometimes, it's not like I've totally put away my prescription pad. I'm just saying, like, if we can treat everything else first and make sure there's not anything else wrong before that, it could be a good thing. So things that we looked at: nutritional deficiencies. We looked at detox pathways. I looked to see if he had elevated cryptopyrrole, which is something to do with B vitamins and zinc in the body. We looked at toxins to see if there was any elevated heavy metals and or environmental chemicals like BPA and phthalates and benzenes and all of that, which I got to tell you, you guys, if you have not done a toxin test, you're going to be shocked. Even if you're doing like 100% organic and all the rest, it's like everyone has toxins nowadays. Okay. So we looked at all of that. We looked at his sleep schedule, which, like most kids is not perfect. And his was certainly not, because he was getting into those preteen years where he was wanting to stay up quite late and all of that, push back. So we had to kind of work on that. And he was quite anxious. So he was quite worried about like teachers and school and all of this that was kind of like running through his mind. So by looking at all of this stuff, we found that he had nutrient deficiencies, in particular, believe it was the B vitamins, and he also had some issues with his serotonin pathways. So those like calming chemicals, the ones that help you stay like happy and calm. We also discovered his like sleep hygiene was a little poor because screens, let's be honest. It's like screens. And then we had to work on his dysregulated nervous system. I think at the end, we also did some toxin clear out, if I remember correctly. And he was actually able to focus after all of that. It wasn't perfect. No child is perfect, but we got him to a point where he really didn't need medication. The teachers were noticing a difference. He was more regulated, more calm. And yes, there was a lot of work on the part of this poor family, as there are for many of us, because we grow up with a certain diet where we're not used to eating a certain way, and it's difficult to make changes. And it's difficult to support a preteen with schedule changes and becoming less anxious and all of that. And you know what? They really did the work, and this child is now truly thriving. So those are kind of the different ways that I look at things rather than just saying like, well, it's just a phase, which we hear so often in like conventional medicine, like, let's wait and see. Or like even worse, like when you get those, it's all in your head. I don't see what you're even talking about. And so it's better to address these things, especially when it comes to things like inattention and anxiety. It's so much better to address these things when they're small rather than, not that we can't address them when it's a big problem, but it's a lot more work and it's harder. So if you're noticing, little things in your kid, bring them in sooner, because really that's the time rather than just kind of waiting to see which way it goes. Especially with anxiety, I will tell you, almost always gets worse unless we figure it out. Another key difference in my practice is I'm not just treating a diagnosis. I'm really treating the whole child, the whole family. So I wholeheartedly believe this to be 100% true. It is absolutely impossible to treat the whole child outside the context of their family, right? Because kids do not exist in a vacuum, right? We live in, I'll speak for myself. I live in a house with my husband and my 3 dogs. And what I say affects him. What he says affects me. What I'm eating affects how he eats. How late I stay up affects how late he stays up. If I'm dysregulated, he's going to feel it, you guys. So everything is relational as well. So we have to take this in context of family systems so that we can address dynamics and routines and school, nutrition, emotional environment, environmental toxins that, exist, whether it's like, heaven forbid, those plates that your grandma gave you didn't know were covered with lead, or, your neighbor, your well-being neighbor sprayed your weeds, but it ended up being, pesticide and not the vinegar that you would normally use, and things like that. So we really need to support everyone, including the parents or grandparents, whoever is taking care of that child, okay? Or guardian, whoever you are. We need to support you too. And so I want to make sure that I'm supporting a parent's nervous system as well. And that's why I also see parents for functional medicine. And the reason for that is it is very, very difficult to have a kid with chronic health issues, or even just a kid that you want to optimize their health when your own health is falling apart. And I can even speak to this as a doctor. When my health was falling apart, very difficult to take care of patients, right? When you're sleep deprived and you're hurting and you're burned out and you have an autoimmune concern, or your hormones are off, it's very, very difficult to be present for people, okay? And especially when a kid is having either behaviors or chronic issues, how do we take care of that person without falling apart? So if you're in need of any of that, if you're a burned out parent, you have 3 kids under the age of 10, you work, you live in society today, your hormones are off, you've gained weight, you're fatigued, all of that, I want you to come and see me as well, because I can help you with that. Okay, I don't want you to wait. And I also want to make sure that if you have a kid and you're seeing me with your child, let me know when you need that care. I'll ask you, but if you know up front, hey, I need it too, let me know, because I want to get started on it right away, because we cannot pull kids out of their family units, unless you're undergoing some kind of like extreme social experiment, which would be terrible. So we're not doing that. We need to treat the family system. So what do families actually deserve? I 100% believe that every child deserves more than they'll grow out of it. Okay. If you have heard that and it's been more than 3 weeks and your child has not grown out of it, whatever it may be, they'll grow out of the stomach pain. They'll grow out of the inattention. They'll grow out of the anxiety. They'll grow out of the constipation. It's just a phase. They're not that depressed. It's just mood because they're teenagers. They're not that anxious. It's just because they're teenagers. If you're hearing that and it's been more than 3 weeks, your child deserves better. You know your kid. You know when things are off. You know they deserve a doctor who will listen, who will investigate, who will walk alongside you and support you. And you know that you deserve more than being dismissed or made to feel like you're imagining things. So I'm here to give you that. I'm here to walk alongside you. That said, I do expect my patients to walk alongside me. And what does that mean? When there are changes that need to be made, that we're working towards making them. Does not mean that we're 100% perfect. Nobody is. And I would never judge anyone for not being 100% perfect. But we do need to work together because I'm here, I'm invested, I'm 100% in, and I'm looking to build a practice of patients that are also 100% in. And that's why I have this very small community of patients. So here's what I want you to remember. One, there is a different approach to your child's health. Your child deserves more than quick fixes. They deserve care that sees like the whole picture. And you deserve to feel heard and supported and empowered. So if that resonates with you, if you want personalized care, if you want time for your kid, if you want a doctor who will walk alongside you, then I encourage you to go to my website, sign up for that meet and greet, and also stick around on this podcast because this podcast is full of conversations I wish more parents had access to, which is why I'm doing it. And I talk all about everything from gut health to inflammation to different genes to different providers in the community. And it's honestly a great resource. And feeding your baby too, if you need help with that. So sign up, share it with a parent who needs it. Thank you for being here. You guys are doing great. You're doing amazing. And I will talk to you next time. I am wishing you well. And I'm Dr. Ellie, if you don't know who I am, at Middle Path Integrated Pediatrics in Asheville, North Carolina.